All right, a very good morning to you. It's good to see you on this Tuesday morning. I hope that you are well, wherever you're watching us from. Are you dealing with the postman, the man, or you know, real or not? I hope that you're well this morning. So good to see you. This is Your World. My name is Winnie Lubem, and of course we have very important conversations that we need to cover in today's show. And of course we have, you know, two parts of the same. So for this first part, we're going to talk about COVID, okay? And I know majority of us, you know, when you mention COVID, everyone's like, hiya, when do we still have COVID? Yes, it is still here with us. And of course, like the Ministry of Health keeps saying, we are not out of the woods yet. And of course, there's a lot of calls, and this is as far as vaccination is concerned. So today we just want to take a look at how are we doing as far as the vaccination is concerned. You know, are we seeing an increase in the number of people who are going to either get vaccinated for the very first time? There are a number of people who have not been vaccinated. Are you going for your second dose? Are you going for the booster shots? And how are we doing as a country? You know, and even in different counties. But of course, we'll also focus a little bit on Nairobi today. So you want to stick around for the next, 30 minutes. All right. So we have this conversation. Of course, to help us with the same, we have Lillian Mutua, who's the head health promotion Nairobi City County. Thank you so much, Lillian, for making time for us this morning. And I'm just going to ask you that very question that everybody keeps talking about, COVID. Kwani bado kuna COVID? Let's just start from there.
COVID is still with us. We know that even up to now, people are getting seriously sick, ending up in hospital, very serious illness. And once in a while, we find that they are COVID positive. And the most interesting part is that when they are tested to be positive, those who get critically sick, if you look in their COVID vaccination history, they've not been vaccinated. Okay. So it's very real that the COVID vaccine helps us to not get very serious disease and not also to develop further complications. So we are not yet out. And just like I was talking to you a while ago, people in Nairobi and other parts, you find people are saying, I have this severe cold.
Yes. Was it like, what, last?
Around 2 weeks ago, yes. And then mid-January and also the end of December. People are coughing, people are saying that they have homa and they are feverish. So it's just because we stopped the mass testing, which right now is not the strategy. But even for those who are referred, they turned out to be positive.
Absolutely.
Yes.
So still COVID is here.
COVID is still with us.
Here with us, and we cannot ignore the fact that, you know, we're not out of the woods yet, and just take all the necessary precautions. And as much as some of these measures were, you know, laid down a little bit, it doesn't mean that we are completely out.
Yes, and especially when people are saying that there is that cold. We've seen the masks did magic for us. Yes. And even those people who normally get allergies, people who get asthma, people who get the respiratory infections every now and then, that reduced with the mask. Yes. So when we hear people saying there's homa, there's sneezing, there's coughing, let us just put on the masks.
Absolutely. So
I think it's one of those preventive measures that we will learn as a healthy behavior for now and into the future. Yeah,
I remember the former CS, Mutahi Kagwe, kept insisting that you need to take the precautions. You don't have to wait until the government announce and say, you lazima buy masks, so that we all put on masks. You put on your mask, you know, for yourself. But let's track, you know, the vaccination, right? How are we doing as a country? Because so far we have what, 1.7 you know, million adults that have been vaccinated in Nairobi, right? But what about, you know, the countrywide situation? What do the numbers look like?
I know Nairobi is the leading county so far. We are doing at 58% of our expected eligible population that's supposed to have been vaccinated. But we know that this being done, we have still some people who started the vaccination very late. We even have today people who are getting their first doses. So when you look at cumulatively from even the beginning of this year, we have those who have gotten their first, they're yet to get their second. So we normally look at the coverage for someone who has at least gotten to their second vaccination. But when we look at the larger Kenya, we know there are counties who are doing dismally poorly. We have people who are doing less than 10%, 20%. So we are not yet there. So you find that maybe the first 10 to 8 counties are doing pretty well.
All right.
Maybe heading to 50 or just slightly above 50, but most of the others are also trailing behind.
Yeah.
So unless we get to a point where we know we have vaccinated so many people, then we can say we are not yet out of this.
Out of the woods yet.
Yes.
Okay. So then why the disparity? Because in Nairobi alone we are at about 58% of total vaccinations, but then we also have other counties, that are not doing so well. So the big question is why the disparity? Is it that we have a lot of vaccines in Nairobi as compared to the other parts of the country, or what exactly is happening?
What we know is that first of all, people misinterpreted the information that was being given by MOH.
All right.
That is when the measures for COVID prevention were slightly eased. When people are told that they can now do without their masks, the transport sector can now go to full capacity, the social amenities like the churches were opened, people are told to go back to work. People misunderstood that communication, and they thought it said COVID is over.
Okay.
So with that, there was a lot of relaxation. Then also when people were told that they will not maybe be able to access certain services, they only got the single dose, and they never went back to get the second one.
Okay.
Then the information that is in the social media has done a lot of damage. I remember just last week, someone was saying that in the US, the government has been told to step down the vaccination because some research has been done and this has been said and people have gone to this court. And when you really look at that information, it was not coming from the US government. It was just someone who was pulling strings on social media. Also the issues associated with side effects. This has made people misunderstand what side effects are because they think that anybody who gets this vaccination then has their consequences after getting the vaccine. But for any drug that we take or any medication that we take, you're always told that there could be a side effect. Interestingly, that as much as we say people got side effects, we always tell people if you think that any side effect has been prompted by a medication that you've been given or a vaccination that you are given, kindly report to the health facility so that we can get that information, we can record that incident, and then we can follow up. But interestingly, people did not show up, people have not reported, so we don't even have a database of the side effect that the Kenyans got. Then also when we started the vaccination in Kenya, we had the eligible population that were on the first list. That is the frontline workers. Then we had the elderly, and then we had the people with comorbidities, because we were giving as the vaccines come in, we give priority to the people who are at most risk. So people also misunderstood that. If you look at the youth, that is people between 24 to 35, a lot of them have not been vaccinated. For them, they feel like because that information was given, then it means that they have immunity. But what is interesting is that they could be having a relatively good immunity, but when they get the consequences of COVID, they'll either get very sick, or even if they are not very sick, they also continue transmitting it to others.
Absolutely.
Also for the children who are 17 and below, because our MOH guidelines allow us to vaccinate children who are between 12 to 17 with COVID vaccine, and specifically with the Pfizer vaccine. We have also seen some of the parents not taking up the measure of allowing their children to get the vaccination. But Ministry of Health has worked very closely with Ministry of Education. We've had several stakeholders meeting. We keep updating them with any new information that comes in, and we really appreciate the parents and the teachers and the educationists within Nairobi County, because they've taken this up. For example, just when the schools were opening, we were able to even visit the schools where we talked with the parents as they brought their children to school. And also before the midterm, most of the schools in Nairobi were having parents meetings, and also the Board of Governors meeting. So we went there, we spoke to them, they were able to ask any questions they had, we addressed their concerns and worries, and even some of them, before they took their children now for the midterm, they were able to accept their children to get their vaccine. And not only the children, even some of the parents now understood, and they too got the vaccine at this point.
Interesting. All right. So what were the biggest concerns for the parents, especially when getting their children to
most of them feel like their children should not be vaccinated when they are not around. And we normally say if that is the issue, then for those who are in the day schools, we still offer vaccines in the religious institutions, that is the church, the temples, and the mosques.
All right.
You could also arrange for that to be done. Then we also have teams that walk into the community on specific days over the weekends and also over the weekdays. And this is informed prior that this team will be visiting this site on a certain day. So this has also enabled us get vaccinated children who are 12 to 17. So we use different strategies for different people. Then we also have letters of notices that we write to the parents of the children who are eligible. And these notices are given through the schools, and the information reaches the parent. That is a notice of the vaccination ongoing on an expected day in a certain school. And this notice is delivered to the parent. So the parent will sign and give their ID number, their telephone number, write the child's official name and the NIMIS number. So when the child is being vaccinated, we normally have the NIMIS number and the parents' contact so that they can get that information. And we also keep a register at school and also with the facility that's vaccinating them.
I see that. I see that. All right. And you said, of course, they're being vaccinated between the 12 to 17.
Yes, with Pfizer.
Why is that?
This is the vaccine that was researched with that cohort and found to be safe. The rest, they didn't have people who came up. So this, and it's not only in Kenya, this is approved by WHO.
I see that. So, and you said something that's a little bit concerning for me, and that is the youth. Majority of them, have not been vaccinated, and yet this is a very active, age group, and all those things. They are outside, they are in masses. I mean, yesterday we had Mandamano, right? And of course they said this will continue every single Monday until something is done. So then that's, people congregating. Majority of them are young people. So because now the ministry is not conducting mass testing, mass vaccination and all those things. So then what happens in such instances so that we target this very active, age group?
We are working very closely with youth leaders. That is in the institutions of higher learning, the tertiary colleges, and we also look at their different social groups. For example, we've worked very closely with the Matatu fraternity, the border, the hospitality, that is here in Nairobi. And when we are looking at community entry, we also bring the different leaders of different youth groups on board. We talk to them, and we have found that from those conversations, they are able to bring their youths on board on a specific day at a specific site, and starting even with some of the leaders who are not vaccinated, they get vaccinated and then their peers get vaccinated. But it's not only for COVID. Even when we look at issues of teen pregnancy, issues of new HIV rates going up, it's also within that age group. So I'd also request the parents, the guardians, their caregivers, people who are decision makers and influencers for this youth, they should start these conversations with them. Because if in future we will have youth who don't have very good health, it also means we will not have a very able work population, and also it might also hamper their life expectancy.
Absolutely.
Yes.
In the
so
long
it is
run.
all, it's all round.
Yes.
And
I remember when we first had, you know, the vaccines here in the country, there's a lot of hesitancy, you know, amongst so many people. But again, that's changed over time, up until here we are today. Yes, the majority of people have been vaccinated, but also we have a lot of people who have not been vaccinated. Others, like you said, went for the first doses and completely disappeared. And one of the reasons were a lot of myth and disinformation surrounding, you know, the vaccines. The whole question about fertility, which a lot of people were scared about, right? So here we are today, and like we said, we're still, you know, not out of the woods yet. So dealing with those myths and disinformation, because there's a lot of campaign to tell people the truth about the vaccine and all those things. So what worked, what did not work, and what do we need? Is it time that we sort of like change tactics so that we also get people to get vaccinated and deal with the myths and disinformation?
For Nairobi, where we are today, it's because we listen to the community. We do very targeted messaging.
Okay.
Like if it's issues of fertility and fertility, we will listen to what the community is saying, and we will make targeted message towards that.
All right.
If it is issues of maybe
Pregnancy,
the population that is maybe pregnant and lactating mothers, we listen. We do what we call social listening.
All right.
We listen to what are their concerns and address that with facts.
All right.
And then we are able also to bring on board people who have been vaccinated and are of that cohort, and they give their own experiences after COVID vaccine.
Okay.
For people who are talking about fertility, there are people who got jabbed in 2021, people who got jabbed in 2022. Some of them have gotten children, some of them are now pregnant. So those are just myths and misconceptions.
Absolutely.
Yes.
All right. So Nairobi has done fairly good, but like we said, again, there's still a number of people who have not been vaccinated. So what is it that some of these other counties can learn from Nairobi? I'm going to come back and so we can also talk about with the digital era, right? Everybody is, for example, on social media and all those things. So how do we harness the power of, you know, this digital space? But before that, what is it that other counties can learn from Nairobi? What has specifically worked? Because like you said, listen to the communities and address their concerns and give them the right information, making sure that there is enough vaccines for everybody. So what is it that these other counties can learn?
First, you need to look at your population, segment your population according to the eligible populations and what their worries are. If it is issues of men and fertility, then you should listen to these men, sit down with them and give them facts. Look at who are their influencers and decision makers and make them understand what are the benefits and the importance of getting the COVID vaccine. Also, we need to look at where are some of these populations, because like we know even we have the nomadic population. So if it is a nomadic population, when do you vaccinate them? How do you track them, and which vaccine do you use? All right. If it is the those 12 to 17-year-olds, how do you get approval from their parents and caregivers for you to deliver that vaccine? So for Nairobi, what we've done is that we have multiple stakeholders at county level, at sub-county level, at ward level, up to village level. So you find like every month we have a stakeholders engagement, looking at specific issues that have come back, also addressing that, and then resolving that through all those stages up to the consumer level. And we have seen results.
We have seen results. Okay. But also making sure that there is availability, because I think, was it last year or the year before, there's a lot of complaints, you know, from the people who are saying, listen, yes, you want us to go and get vaccinated, which is good for us, protects us as a people, but then when we go to the facility, there are no vaccines, right? So then making sure that there is availability of vaccines, because again, there are some other areas that the ministry used to say, you know, it is far-reaching areas. By the time the vaccines, you know, get there, it is not viable, you know, and all those things. So making sure that, yes, the vaccines are available and people can get them.
So we've not really run out of vaccines at any given time. Maybe what I could say, maybe incidences of maybe some people doing wrong timing or not scheduling their vaccinations as appropriately and as friendly to the community. Because we don't even say that maybe if it's a far off region or a community that is living very far or has maybe moved direction, then the vaccine will not be viable. The viability of these vaccines is about storage, and all these vaccines are stored under a cold chain system.
Yeah.
So we ensure that that is done. And if they have to move, even maybe moving from Nairobi, where we have the national stores, to the end where this vaccine will be used, there's a chain of how they will be taken there.
All right.
And they even are flown to the very far regions. So we can't say that they will not be viable. We always check the cold chain system. This is routine, and reports are given on a daily basis, on a weekly basis. If there are any concerns, they are addressed. So the viability of the vaccine is there. The only thing I know is that at times we might not have all the 5 types of the vaccines.
Yes, yeah.
But research and WHO and Ministry of Health has said that they have allowed a mix of the vaccine.
Okay.
So maybe if you got AstraZeneca as the first dose, don't refuse to get a second one because AstraZeneca is out of stock.
Okay.
You can still get the Pfizer, you can still get the Johnson & Johnson. This will be discussed with you by the service provider, and you'll be given what is available and what suits you best.
Absolutely. Safety is one of the things that needs to be considered. All right, let's come back to Nairobi, right? Social media, and of course using the power of social media to, number one, either pass the message, because again, like we said, we had to deal with a lot of mis and disinformation, and also, you know, the vaccine hesitancy because of so many other reasons. So social media and the digital space, how has it worked?
For us in Nairobi, I can say that we've come a very long way.
Okay.
I think for Nairobi in 2022, we also started our Nairobi campaign, which is Pata Chanjo, Kuwa Chonjo, Kanairo Tuko Chonjo.
Yes.
You've seen these adverts. We also came up with our posters, which show people who are known and who are recognized in maybe health or in the religious circle or even youth. So we did this just to show people it's real. We've also at instances had people give their testimonials on short clips and shared this on WhatsApp groups, and especially within communities. We've also had a lot of photography being done of people who are known in the community, and we sent that on WhatsApp community pages.
All right.
So this has also given us a good space. All through, we've also been making specific county posters.
Okay.
Like if tomorrow we'll be maybe going to the All Saints or in Mwiki at a certain site, we do our posters 3-4 days in advance, telling people where this vaccination will be, the timing, the eligible population, and then we even share our emergency operations center number for health sector, Nairobi County, and you're able to call free of charge, ask any questions that you have.
Okay.
We'll address your concerns, and this has also been very good because apart from the COVID vaccination, we are also asked about routine immunization for the babies. People ask us about the HPV. When we were doing the cholera, they were still calling and asking why they are not being reached because we only had 2 counties. And also any health emergencies. All right. That number has been used very frequently.
Okay. All right. So then when it comes to innovation, because like we said, a lot happened, you know, 2020, 2021, a bit in 2022, right? And this is in terms of the different approaches that the ministry takes and Nairobi as well, just to make sure that people get the correct message and all those things. So then what sort of other innovations are being employed? I know you talked about social media, which is a good thing, but do you have like other, you know, innovations that you've had to, you know, employ just to make sure that, you know, the message is out there?
I also think we were the first county to start working very closely with the national government administrative officers.
All right.
And they have been our frontline custodians of messaging, so that we make sure that wherever we are doing an activity, we have someone along that line. We also brought the teachers on board, the educationists, and at least we touch base with them every month. That is also another innovation for Nairobi County. We also have our own branding for COVID-19. You'll find us in aprons or in jackets or in t-shirts. written pata chanjo kuwa chonjo, COVID-19 vaccination, others written chanjwa. We have tents that we put in sites that are also having the COVID messages. We have banners. So we've gone a long way. The other thing we do is that we really leverage on media stations for getting the listeners to know what is happening in the COVID-19 and also COVID vaccination space. So we've worked very closely even with our community radios, with other online media stations, just to pass this information around. Not also forgetting, we have migrants in Nairobi who don't have their right papers. We have the vulnerable population, we have injecting drug users, we have the families who are homeless, living in the streets, we have people who have disability. So we make sure there's inclusion of all those people. And when we are having our stakeholders meeting, for example, right now we are at ward level, we look at who has not been reached. We are doing our micro plannings. We look at who has not been reached. We bring the decision makers, the influencers, the leaders of that population into our stakeholders so that we can have a candid conversation, and then we plan with community. The beauty of Nairobi is we plan with the community, including the upper hand. At the upper end, the upper social strata, you find that we work with the religious leaders because we have demarcated and known where do these people go to their religious institutions. We also look at their social spaces. Over the weekend, where do they go? We also take leverage of social events, be it a wedding, a funeral, people who are sporting, where there's entertainment. We have made sure we have penetrated these places. The hoteliers are also frontline workers looking at their job. So we've also approached them, and we have vaccinated very many employees in the hospitality industry. So you just need to understand how does your population work. With the people who are in the transport sector, the boda guys, the cab drivers, the matatu fraternity, we do not pull them from work. They give us a designated place along the route. And as they work, we vaccinate them. And the beauty for that has been, as we vaccinate this transport fraternity, the consumers of their services, their passengers also come down to get vaccinated.
Interesting. Interesting. All right. So just find ways that, you know, you can get to the people.
To the last person.
All right. So as we bring this to a close, because I can see our time is far much spent, you know, now that we're not doing mass testing and mass vaccinations and all those things, I mean, you are very instrumental in making sure that us here at NMG get vaccinated because you brought it here to
National
us.
Center.
Exactly. So then in terms of making sure that everybody, especially here in Nairobi, is vaccinated, because there's a lot of inter-county, you know, movements as well. Maybe someone who was not vaccinated coming into the city, you know, and all those things. Just to make sure everybody is vaccinated, what would you say, very briefly, as we went on the conversation?
Especially in CBD, we have had these sites at the Bomb Blast, at Kencom, at Country Bus, at Globe Roundabout, and also at the archives. And you find most people who are coming from other counties will always traverse those places. We have made sure that once in a while, maybe after every 2 to 3 weeks, we have a station there. And for the people who come from out of Nairobi County, they do not need anything else other than just give us their ID number and their telephone number. For those who have gotten the first, can still get the second. So like at around archives and Kencom, we've vaccinated very many people coming from Kajiado, Machakos County. Also from country bus, a lot of them from different areas. From Isili, at the shopping malls, we also vaccinate a lot of people who come up, who are coming to do business, and also who are coming from the northern frontier. Just before we finish, we are also giving the HPV vaccine, girls 10 to 15 years. We deliver this vaccine at school and also in the community and religious institution. And also let us remember, children have just been out on a midterm holiday. We know that there are people who are traveling for different reasons, especially for business. We have seen a lot of, Nairobi is very prime for inter-county transportation and also an international hub. Let us remember, we still have the cholera outbreak.
Yes.
It is not yet over since 2022, October.
Yeah.
So we are urging people to stop eating maybe by the roadside, not to make sure the water they are taking is safe. And in case you have any profuse diarrhea that is watery, effortless, the first measure we want you to take is to take a lot of water.
Okay.
We lose people because of cholera, just
yeah.
because of dehydration.
I see that.
So let them report for Nairobi. You can always call 1508 to give us your concerns or your worries, and we will be able to address.
I like that. Thank you very much, Lillian. I know time is like this much,
yes,
but
and
we'll
also
have you
for
again.
MTV, for Nation Media.
All right.
Those who still need their second and booster dose, we are readily available.
Okay, all right. I like that. Thank you very much, Lillian. I know we need more time to have this conversation, but we'll have you again, so that you also give us updates as far as how we're doing in terms of vaccinations and what we need to do to make sure that everybody is vaccinated. But allow us to end this conversation here today. Lillian Mutua, Head of Health Promotion right here in Nairobi County, giving us updates as far as how we're doing as far as COVID-19 vaccination and what we need to do. So if you have not been vaccinated, go to the nearest health facility near you and get vaccinated or get a booster shot. So let's take a break. But of course, when we come back, this week is also Global Money Week. And of course, today we want to understand how saving culture, also contributes greatly in terms of the economic development. Stay with us. This is Your World. See you shortly.